Welcome to our presentation looking at contrast-induced nephropathy in patients with renal impairment at Peterborough City Hospital. Our aim was to achieve a prevalence of less than 10% of contrast-induced nephropathy in patients with known renal impairment, or an eGFR less than 30. This study was developed as there are no current guidelines on the prevention of contrast-induced nephropathy at our hospital. Our methods involved identifying patients having a CT with contrast and also known to have an eGFR less than 30 between June 2019 and May 2020. Following this, we excluded those on dialysis as this would affect our outcome, and thereafter collected data on their renal function and IV fluid administration before and after the CT contrast, as well as patients' medical history, such as comorbidities and medications that would impact their renal function. The results of our study used the definition of contrast-induced nephropathy as a reduction in eGFR of greater than 20% within 72 hours of contrast. We found that 4 out of the 58 patients included in our study developed contrast-induced nephropathy. Of these, about 50% of patients had received IV fluids before their CT contrast. On average, we found that contrast-induced nephropathy patients were found to have a higher number of comorbidities per patient and nephrotoxic medication use per patient.
So in conclusion, we found that our hospital actually had a lower incidence than our overall aim, and that the main issue was poor IV fluid administration. In terms of our limitations, we had a small sample size, and this reduced the validity of our overall results. No single definition of contrast-induced nephropathy was found in the current literature, and missing or illegible documentation was an added hindrance, which resulted in a greater number of excluded patients from our study. Aside from making local departments more aware of contrast-induced nephropathy, our main aim is working towards formulating a complete trust guideline and make the process of requesting CT scans more streamlined, with specific questions ensuring it is the best scanning modality, consenting the patients with the risks and benefits of IV contrast outlined, and a reminder to the requesting physician to administer appropriate IV fluids. And hopefully this re-audit in a few months' time will prove better results. Many thanks for your attention.